Hi, my name is Sara Hurvitz. I'm a medical oncologist at the University of California, Los Angeles, and I specialize in breast cancer. Today I'm going to give you an update on hormone receptor-positive breast cancer in the adjuvant setting and review a study called the MA17R study that was presented at ASCO 2016. So the MA17R study enrolled patients who were postmenopausal and had hormone receptor-positive breast cancer and had completed 4.5 to 6 years of letrozole, 2.5 milligrams daily, prior to enrolling. These patients had been on the MA17 study previously, and many of them had received prior tamoxifen before going on the adjuvant letrozole. So patients, when they were completing their 5 years of letrozole, many of whom had received also 4 to 5 years of tamoxifen, were randomly assigned to receive letrozole 2.5 milligrams daily for 5 years. There were 959 patients randomized to that arm, or to placebo. So this study is really getting at that question that many of us have been asking, and that is whether 10 years of an aromatase inhibitor is better in terms of patient outcomes, disease-free survival, than doing 5 years of an aromatase inhibitor. The primary endpoint of this study was disease-free survival from randomization. Secondary endpoints included overall survival and quality of life, as well as safety. It should be noted that over 70% of patients had been on tamoxifen for greater than 4.5 years prior to the 5 years of letrozole. So this study is not really addressing that question of 5 versus 10 years of aromatase inhibitor in patients who had never received tamoxifen. Be that as it is, these data are still very important and novel because they are the first data to address longer-term AI use versus shorter-term AI use. About half the patients had lymph node positive disease. On this slide is a summary of the disease-free survival and overall survival after a median follow-up of 6.3 years. And what you can see is that the 5-year disease-free survival was 4% better in patients who received letrozole for 10 years total, or an extra 5 years, compared to placebo. This was associated with a 34% relative risk reduction for disease-free survival, and this was statistically significant. In terms of the events that were seen, there was a significant reduction in the rates of new contralateral breast cancers in patients who continued on letrozole, 3.2% in the placebo arm, 1.4% in the letrozole arm, and again, this was statistically significant. Numerically, there were also fewer distant recurrences, local regional recurrences, and bone recurrences. So the disease-free survival benefit of the extended letrozole was noted in all pre-specified subgroups. However, the 5-year overall survival was similar between the two treatment arms. There was more bone pain seen in patients treated with letrozole, which is not surprising. They also noted an elevation in alkaline phosphatase in the letrozole arm more frequently than in the placebo arm. And compliance with therapy was similar between the two treatment arms. And quality of life was also noted to be similar between the two treatment arms. In this study, there were more patients having bone fracture and new onset osteoporosis in the letrozole arm. This is not surprising given the fact that long-term aromatase inhibition leading to long-term estradiol suppression accelerates bone loss and increases the rates of bone fractures. So what does this mean in everyday clinical practice? These are the first data to suggest that the use of extended aromatase inhibitor therapy does improve a woman's chance of not having a recurrence in later years. However, there is no difference in overall survival, and this does come at a cost of an increased rate of osteoporosis and bone fracture. Therefore, in my opinion, patients should have a very balanced discussion with their oncologist to discuss the risks of their recurrence as it relates to their personal risk of breast cancer recurrence, as well as their risk of fracture. If I have a patient who is pretty high risk for having a recurrence due to lymph node positivity or higher grade of tumor, I'm going to be more compelled to recommend extended use of aromatase inhibitor therapy in that patient. It is interesting that now several trials have shown that extended use of endocrine therapy leads to better outcomes long term. This data is supplementing the data from the ATLAS and ATOM trials looking at 10 years of tamoxifen compared to 5 years. And both of those trials also showed clinical benefits for patients who continued on long-term use. So I'd like to thank you for joining us for this update on hormone receptor-positive breast cancer in the adjuvant setting from the ASCO 2016 meeting.